Welcome to Thinking Green. My guest tonight is Cindy Barry, who is well known through her work for many years with Ledge Light Health District. So we're going to talk tonight about overview of everything that Ledge Light does, but also zoom in, focus in on a few of very timely things that are happening there. So welcome, Cindy.
Thank you very much.
And I guess maybe just start out with just sort of a brief overview of what kinds of things Ledge Light does and what partnerships it has with the communities.
Sure. So, I appreciate the opportunity because sometimes people know Ledge Light for the part of Ledge Light Health District that they've interacted with or that they've needed in the past. So, public health is really kind of a wide range discipline. We provide services that help prevent injury, illness, and disease in our community. And we do that through our environmental health department. Many people know our sanitarians because they go out and collect beach water in the summer. They're also responsible for letting the community know if there's a rabid animal. They inspect restaurants and daycare facilities, tattoo parlors, and any place where kind of the public interacts in a way that could pose a harm to them. Our restaurant owners know our sanitarians that come in at least 4 times a year, and they inspect their restaurants to make sure that there's no public health threat or harm. Many people have experienced a foodborne illness or what they used to call food poisoning. That's not fun and can be very dangerous. So that's one of the things our sanitarians are really working to prevent. And then we have emergency planning. Chris Magnuson is our community health nurse, and she oversees our emergency planning and also our medical reserve corps, which is having a training tonight at Ledge Light Health District. The Medical Reserve Corps is a group of concerned citizens, people who are interested in serving in different kinds of capacity, whether it's volunteering at one of our flu clinics. Last year, we did a drive-through clinic, which was really fun for a lot of people. They might help in any kind of an emergency, distributing information about how to prepare for a hurricane or any other kind of emergency, and they are generally available at a moment's notice to respond to our public health department in case of a need. So that's very exciting.
Now, how do people find out about this, or what kind of people sign up for this kind of emergency corps?
Really anybody from the community. We have a really nice cadre of health professionals that are involved, and that is really helpful, especially when it comes to giving vaccines. But we also have a lot of people from the community who may want to help translate something into Spanish, or may really like logistics of kind of an emergency, whether it's helping to provide food for emergency personnel, or making sure that people are where they're supposed to be. So there's in any emergency, as you can well imagine, there's a lot of jobs to be done, and so it really is a group of people from the community, and they can find out about it by going to our website. There's a whole About Us area that says Join Us, and that's just one of many coalitions that we have. Most of the work that we do comes from a coalition.
Right.
So.
Yeah, and in fact, on the website, there's a list of partners that's, this long. The towns, the schools, and so many other nonprofit organizations that that work with Ledge Light and under Ledge Light to take on different facets of public health.
Yes, and many people still know of our health education area. We have many health educators, and they do everything from educate the community about asthma to thinking about substance abuse prevention in the community. We've done all kinds of initiatives, whether it had to do with breast cancer early detection or Lyme disease. diabetes, just all kinds of public health issues. And most of our initiatives really come out of our needs assessment. So one of the functions that a public health department has is to understand the health needs of the community, bring people together, develop a plan, implement the plan in the community, and then evaluate it and make sure that it's working.
Now, how frequently do you conduct those needs assessments?
It has depended in the past on funding and the source of funding and their needs, but more recently, Ledge Light Health District has partnered with L&M Hospital. So hospitals are supposed to do needs assessments every 3 years, and the same with health departments. So working together, we were able to do a pretty significant needs assessment, and I think that now we're on kind of the same cycle. We'll be able to work together in the future to do the same thing.
That would make a lot of sense that hospitals could do a lot of the data collection.
Exactly. They have their piece, we have our piece, and then we fill it in. We've done surveys at the farmers market, for example, and that's a data collection. We do surveys on the programs that we teach. For example, we have a program called Cooking Matters, and we work with middle school students. So we do a before survey and an after survey. So while we're looking at the larger needs of the population, we also evaluate our smaller programs too.
Now, one of the big areas on the website is related to promoting healthy communities. Mm-hmm. And a lot of that seems focused on chronic diseases like asthma and just general health and fitness and nutrition. Mm-hmm. But people may be interested in knowing that Cindy was supposed to be on the show about a month and a half ago and was snowed out. Yeah. And that was before a diabetes program was starting in New London, and it has since started in New London, and it's kind of mid-program right now, but it will be starting up in other places in the community. So it seems as though diabetes is a rising concern. Mm-hmm. So maybe you can talk about why that is and what this program is doing to help people deal with it.
Sure. Well, I think it's around 9% or so of the population has diabetes. We have seen an increase, and I think that it's what you would imagine would cause the increased diet, lack of exercise, weight gain, all of those. It used to be that we thought about diabetes type 2 as an old person's disease, but more and more young people are getting diabetes, or they're even being diagnosed with pre-diabetes. So they've gone to a doctor, they've had a series of blood tests, and their physician is worried or concerned enough to say, it looks like your trajectory is going towards having diabetes. So we were lucky to take some training from the Department of Public Health. They have a program that's called Live Well, and it's a self-management program for people with diabetes. It was developed at Stanford University, and it's very tightly scripted program. They've done a lot of research to prove that it improves the behaviors that sometimes can contribute to diabetes, and also the management of diabetes, so that a person doesn't end up with the conditions that we typically think of as consequences of diabetes.
And many of them really are serious. They're beyond just maintaining diet or taking insulin.
Exactly. So, we think about heart disease, also circulatory problems with diabetes, whether it leads to amputations or kidney disease, neuropathy, which is kind of a tingling or a lack of sensation in the extremities. So there are a lot, not to mention not feeling well and being debilitated by kind of a blood sugar that's out of control. So we were really excited to participate with the Connecticut Department of Public Health and take the training to facilitate this program. It's a 6-week program, and it really one session builds on the next. So people commit to coming to 6 weeks. It's about 2.5 hours each session, so it's really intense, and it's for adults.
Now, are the people who are signing up for it all people who have been diagnosed with either diabetes or a pre-diabetes condition?
Yes.
And so they're just feeling out how to live with that?
Yes, and also, Rana, the nice thing about this program is that caregivers or spouses, support people can also come with the person that has the disease. So that's a little bit different than a lot of programs, and we're finding that it's really a very great support mechanism to have that person. You know, when you go to the doctors, especially if it's something serious, it's really nice to have a person with you so that two people are hearing the same information. Right. And very often one partner may be cooking, more than the person that has diabetes, or responsible for different things. So it's really nice that a person can come either with their brother or sister or whoever their caregiver might be.
And it seems to me also that, since I'm guessing that a lot of the changes are kind of lifestyle changes, really a whole family has to buy into it. You can't just have the sick individual going it alone.
Yes. And one of the things people will say is that, gee, I've been given this diagnosis by my doctor, but nobody in my family wants to believe it. They still want to heap on the ice cream, or kind of invite me to that big banquet where lots of fatty foods are going to be served. And so I think that's one issue. But one of the things that we do talk about, I think it's around week 5 or so, is communicating. And we give a lot of examples of how to communicate with your family members around your own needs. Many people feel like, well, now I have diabetes, that means I can't go to any weddings. I can't go do any of the things that I used to do. And so that part of the program is really relearning, what can you do in moderation, and the things that you can't do anymore because of your condition, how do you communicate that to your family in a way that helps them understand what your needs are?
So, the program that's in New London, you said it started out very small and it's been building.
It has, yes. We started with 6 people. We really need to have 8. So we were very thankful. We put a small ad in the day, and that helped us out a little bit. We got some more referrals from healthcare providers. Word of mouth is never underestimate that. So we got a few people that signed up because of word of mouth. And then we had some support people. The people that came that first day went out and talked to other people that they knew that had diabetes. So we were able to fill the class. We have 18 right now, which is really great.
And this has a few more sessions, but I noticed that even though we missed the opportunity for you to come on the show before the New London classes started, there's a series coming up in Waterford fairly soon.
Yes, and we're taking names all the time and trying to figure out when are people available, when would they like the program. We're trying to mix it up a little bit so they're not all in the same town at the same time. So we decided that our program in New London right now is running from 4:30 until 7, kind of that after work time. And then the next program we'll do is during the morning. So give people an option. But yes, the next program is going to start on Tuesday, April 18th.
So just a few weeks away.
Yes, so thank you for allowing me to come on your program. It will be from 9:30 until noon, and it will be at the Waterford Community Center, which is on Rope Ferry Road.
Yeah, right next to the Friendship School and the high school.
Mm-hmm.
And I noticed in fall it's coming to Groton, so if people are already in summer mode, not that the weather's cooperating, but thinking ahead, it's going to be given in Groton as well.
And that will be in the evening. That'll be a 6 to 8:30 for those people that work. And that's really the feedback that we got from a lot of people that said, geez, I'd really like to come, but I work during the day. Could you please have a program at night? Which is great.
So You said that it's 6 sessions. So can you break down a little what the topics that are covered would be?
Sure. The first time when we get together, we make a long list of concerns as people go around the room and introduce themselves. And not surprising, I think the number one concern is, what can I eat? What can I eat? When should I eat? How much should I eat? And kind of how do I now change my, especially those evening snacks, to something that's healthier? So nutrition is a big part of it. We spend a little bit at each session about nutrition. We actually go into menu planning and label reading, because there's a lot of hidden sugars in foods. Names like sucrose, fructose, lactose. There's all those.
And when you add them all together, sometimes foods are just loaded with them.
Yes. And so, kind of relearning or learning how to read labels, how to make some simple choices and changing changing their nutrition. And then also another day we talk a little bit more about monitoring blood sugar. When to do it, what time of day, before eating, after eating, 2 hours after eating. And also we talk about exercise. Exercise can bring blood sugar down because the sugar in your blood actually gives you energy. So when you use that energy up, then your blood sugar goes down. So we talk a lot about exercising and the importance of exercising after a meal. It helps to kind of counterbalance the spike in blood sugar. We also talk about, I mentioned communicating with family, but also communicating with your healthcare provider, going to the doctor's office with a list of your questions. Sometimes your visit's all of 10, 15 minutes, and you might think, oh, I forgot to ask, such and such. So
you have to go in organized.
Yes, go in organized. And also, really leaning on your pharmacist a little bit. We have some great independent pharmacists in our community who are willing to sometimes even give out samples of lancets and equipment to monitor blood sugar, but also kind of eager to educate people in the community about how to better take care of their diabetes and monitor their diabetes. We talk about what to do in sick days. Many people with diabetes feel like if they don't eat, they don't need insulin. And the only way that they're really going to know whether they need the insulin is to test their blood. But many people wonder, well, what do I do if I have the flu? So we talk a little bit about that. We also talk about tips for dealing with stress. Stress can be a trigger for blood sugar. It's kind of our fight or flight syndrome, where we dump a lot of stuff into our blood thinking that we're going to need it when sometimes we don't. In fact, sometimes people don't even realize they have diabetes until they go into the hospital for something totally unrelated. It could be the stress of an illness that may kind of not cause diabetes, but raise their blood sugar to the point where their physician becomes concerned about it. And that's when they end up being diagnosed. But dealing with stress, and we do a little bit of meditation in the program. We talk about how people can manage their stress a little bit better. We also talk about setting small, achievable goals. So that's my favorite part, actually, of the whole day, is when people decide what their action plan is going to be. And many people say, well, I'm going to lose 50 pounds, or I'm going to run a marathon, but we've tried to break it down so that, people who maybe haven't been exercising, we say, exercise, walk for 10 minutes. Just go for a 10-minute walk after you eat dinner. And, start slow. And people really choose the things that they want to work on. They might want to monitor their blood sugar a little bit more. They may want to integrate more fruits and vegetables into their diet. They may want to communicate maybe with a family member they haven't. And so we teach people how to make an action plan, something that's action specific, something that's achievable. We ask them what their confidence level is that they're going to achieve this during the week on a scale from 1 to 10. And we're looking for a 7 or greater. So those are all kind of components, and we frame that as kind of a toolbox. You know, life, you kind of have a toolbox of all the skills and things that you're going to need. And it's the same for diabetes. You have a toolbox, and you may know a lot about nutrition, for example, but you may not know so much about stress. So everybody comes with a different agenda a little bit.
Now, this is the first series you've done, correct? Or have you?
We started last year, and we did one at the Groton Senior Center, and we did one in Waterford.
So what kind of responses have you gotten from people who completed the program?
I think that what surprises people is how supportive the group is. And, you know, we're called facilitators because we just make it happen. But really the magic is with the people that come to the program. One person may have a really nifty way of putting together their menus for the week. Another person may have some motivation for exercise. So everybody really shares where they come from. I think that's the most meaningful part for me, is just really realizing that, you know, the people that come, they all share very similar concerns. They all have different levels of support. But when they leave, I think they feel like they've been given some more tools that they can use, and a lot more confidence. It's, you know, complicated. Diabetes can be very complicated and confusing, and I think just seeing really on the people that participate, seeing on their faces that they feel much more confident about taking care of themselves.
Well, I noticed, you know, if you look at the website and, you know, just looking around, it seems as though chronic diseases are really the ones that we're having a problem with. Medical science has done a lot to help us respond to acute health emergencies,
Right.
but not just diabetes, but asthma in general, you know, health of our heart and fitness levels and nutrition.
Arthritis.
Yeah, a lot of autoimmune diseases, which are chronic. So what kind of things, are there any general things that we can be doing to stop triggering this stuff?
Oh gosh. Well, you know, I think the things that are common sense, like eating well, having a diet that's more centered on fruits and vegetables. Exercise is certainly important. Weight maintenance is really important. And then not smoking. I think those are the 4 big things that we really need to do to take care of ourselves.
Now, one thing I noticed too is you have a category, healthy homes, that talk about things like, well, I think you mentioned some lead testing before, but things like indoor air quality. What kind of programs do you have to help educate or enforce food safety, or, you know, lead safety, or indoor air quality?
Well, I think first and foremost, you know, we're always looking for opportunities to get out into the community. So we search those out, and we really would like for the community to call and let us know, are they doing a health fair? Are they bringing people together to discuss a topic? We want to be there to provide education and to meet with people and talk about their concerns. You know, funding comes and goes, and that really does direct some of what we do. But we've been very thankful to work with the City of New London on their lead abatement program in the past. Our asthma initiative is great. We have a program that's called Putting on Airs, and that's where we have an asthma educator that goes into the home, often with a sanitarian. And while the educator is sitting down and going over medications and asthma response, the sanitarian can be looking for triggers in the home, whether it's old carpet, whether it's mold, dust, cockroaches. You know, they might be able to look for things that are causing the triggers to asthma. And that's a very popular program, and it really is a service that we provide. that is grant funded. So,
Well, Ledge Light, of course, interacts with people from a lot of communities, but from the years I worked for Head Start, in New London in particular, because of the very old housing stock, there were a lot of health issues, lead exposure that even pediatricians in East Lyme weren't that familiar with, because the houses that were built in East Lyme were mostly built after 1950 or 1960
Right.
and are lead safe, and
right.
many of the New London houses aren't. So I don't know, what can we do about it? One of the things on the website I saw was health equity. So sometimes
Right.
just where you live
Oh, absolutely.
can be a trigger to some things. Are there
Yeah.
systemic things we can do to help fix that?
Yeah, I think so much, and the things that you've been championing here in New London. A lot of it is about where we live and what we have access to. So if we live in a place that's unsafe to go outside for children to play, if there's no access to healthy foods, but we've got a plethora of places that have unhealthy options, that's kind of the lifestyle that we end up with. And I really have to applaud New London for having a farmer's market, for putting in some bike lanes, for really kind of starting to think about how can we have a healthier community by having these environmental kinds of strategies, like community gardens. So if you look at the top 10, let's say, communities across the country that are the healthiest, they have things like bike lanes, places for people to walk, access to healthy food, smoke-free parks, and New London has been doing some of those things. So it's something that I'm really pleased to see.
And some of that stuff, community gardens they might be in more affluent neighborhoods, but they aren't necessarily. There's no reason why community gardens can't be on every empty plot of land
Right.
in every neighborhood of the city.
Yeah, that would be my goal.
They would all have to be raised beds, because the soil testing
Yeah.
usually does not come back
Yeah.
safe. But
But think of how many opportunities people have for being healthy now in New London with the community gardens, with all the school gardens. Almost, I think every school in New
I think
London
so too.
has a school garden now. And that's a great learning lab for kids to learn about where their food comes from and why it's important to participate in this food movement, in the food system. I think that New London has really changed so much.
And this isn't related to Ledge Light, but I do want to put a pitch in for the community meals that are occurring every Wednesday night at Benny Dover. And a lot of the ingredients that are used are locally sourced. And it's like real food. It's not just stuff that's slopped on
Right.
a plate.
And I think that we've kind of gotten away from filling our bellies and really kind of expecting that food's going to taste good. And I think that, the Benny Dover program is amazing. I know so many people that go there for dinner, and they're just,
We go there
amazed.
not quite every week, but we try to go there frequently, and it's never been bad, and it's very varied. I don't think we've ever gotten the same thing twice.
yeah.
So it's and the plates are actually put together sort of artistically,
Yeah,
which
isn't that great?
so there's that aesthetic side too. So it is a slow process, but getting people used to having real food with a lot of locally sourced produce
Right.
is certainly a step in the right direction.
And I think that, a lot of people in the community that maybe aren't, professional health educators have really kind of stepped up. We have another program that's called Cooking Matters. And the Cooking Matters is for adults or for kids. The program that I do is part of a program for middle school students. And we make all kinds of fun things. And the kids really love being, first of all, in the school kitchen, because it's kind of this mysterious place, and they love learning. Today we used vegetables, and we used the spiralizer,
Oh,
and so
cool.
we took vegetables and we kind of made spaghetti out of the vegetables, and cooked that up, and the kids thought it was great with just a little bit of Parmesan cheese. So, making cooking fun, providing opportunities, and a lot of the facilitators that we have for our Cooking Matters programs are people in the community that really have a passion for cooking, and they just want to share that.
So, well, I guess this leads into another piece of what Ledge Light does, which is food inspections. And you mentioned that Ledge Light goes into restaurants frequently, but it's also if people have public events or,
Yes.
there are a lot of places besides restaurants where food is publicly available. The Ledge Light
Absolutely.
oversees it. So what kind
Yeah.
of process is that?
Well, I think that we have a temporary vendor permit, and I think that's important for the community to know that it isn't just restaurants. But when we have SailFest, for example, you may see sanitarians out at SailFest with their clipboards, and they're looking to make sure that food is kept at the right temperature so that bacteria is not growing, that the people who are serving the food are using safe food handling practices, that they have a qualified food operator on site. So we really do look at all the fairs and festivals in a community, and it's not uncommon to see the Ledge Light hat, the Ledge Light lanyard, the Ledge Light t-shirt. We're kind of all trying to let people know that we're out there.
And even in a Riverside Park in September, we started having a cookout at our annual festival, and it's hot dogs and fruit and beverages. But we do, get that permit, and we are inspected and we have, thermometers, so we know everything's the right temperature. So it's a pretty smooth process. It is not burdensome to do it, but
no. And we do teach some safe food handling classes.
You have a couple different kinds of classes.
We do. We have what we call our cafe class, and that is for maybe somebody who works at a school or a church kitchen, for example, or somebody that really just wants to learn a little bit more about safe food handling. And then we have our qualified food operator class, our Serve Safe class. And those are for people who work in restaurants and who are used to serving food. Each restaurant needs to have a qualified food operator, and so it's a requirement. And we are very happy that we can provide that class for people, because it really is a very close relationship, public health with the restaurants. Restaurant, even though it's regulatory, we like to think that we're working hand in hand with the restaurant owners, the chefs, to make sure that their kitchen is laid out correctly, and that the food is handled in a safe manner. It's not my area of expertise, so it's a little out of my wheelhouse, but I know that that's one of the services that we provide at Ledge Light, and the sanitarians do a great job.
And I'm glad to see that it's a bit more organized. I cooked in child care centers for several years in the 80s, and I did take food handling classes, but I think the whole system did not seem as organized as it is now. I learned about all the bacteria names that give you foodborne illness,
Yes.
but I think it was a much more limited kind of training than what people would have to have now. So I know if anyone is interested in these food handling classes, the information is on the website. And I do want to emphasize that the website has a ton of information on it about all kinds of things.
Yes, we work really hard to make sure that the information that we have is accurate, that people have resources beyond our health department, whether it's the CDC or the Department of Agriculture. We try to be good partners and list the kinds of collaborations that we have and the partnerships that we have. So we're really proud of our website and hope people will go look at it.
Yeah, I was surprised. I looked at it this afternoon, and I didn't follow anywhere near all the links, but there's a tremendous amount of information just on the website itself. Now, you brought a book
I did.
that said living a healthy life with chronic conditions.
Uh-huh.
So maybe you talk quite a bit about diabetes, but maybe what else is in there?
Oh, sure. So I should mention that we're doing the diabetes program, but there's a companion program to the Live Well with Diabetes. It's the Live Well with Chronic Disease program. And we use the same book, which is really great. I don't know if I can hold this up.
I think you probably can. We
get
can
this.
zoom in
This,
on it.
this book is actually, it's available on Amazon, but it's one of the nicest books. It's so easy to understand. It has a lot of information. You can see the self-management of heart disease, of arthritis, diabetes, depression, asthma, bronchitis, emphysema. You know, most people are living with multiple chronic diseases, and it can take its toll, you know, on people. So the program that is taught through the Senior Resources, which is the Area Agency on Aging out of Norwich, they do the companion program, which is the Live Well with Chronic Disease. And it's really a wonderful program for people that have any chronic disease. You know, similar things around talking about diabetes, talking about nutrition and exercise. But people with arthritis and depression and asthma, for example, have similar concerns about how to move forward and live with their chronic disease. It's, you know, the word chronic just means ongoing. Like diabetes, there may not be any cure for arthritis or for asthma, but these conditions can be managed. And I think that people find a lot of confidence building in the program with whatever chronic disease they might have. So our population, I think, is getting older, and many of us are dealing with some of these conditions.
And it seems as though there are so many of these autoimmune and other chronic conditions.
Yes.
More than ever.
Mm-hmm. Well, and people are living longer too. So I think some of these conditions kind of come with the territory of a long life. Our bodies aren't meant to go on forever.
And some things we haven't quite figured out, I think, all of the environmental factors that differ from how people were living 100 years ago, or how people are living now in third world countries where people aren't necessarily healthier, but the profile of what's wrong with them looks different from what we have here.
Isn't that amazing to look at population health and the changes? I remember I talked to you when I got back from Cuba, and I was just amazed at the life expectancy in Cuba and the diabetes rate. And, you know, very interesting that you consider some countries, you know, maybe not having the technology that we might have, but having very long life expectancy despite that. So it is kind of interesting to look at population.
Cuba had to redo its food system.
Yes, they did. When the Soviet Union pulled out.
Right, and it was not easy, and they did a really amazing job at it. People's health actually improved.
Yeah, isn't that something? So I think that, you know, where we're talking on one end, here in public health, doing, you know, addressing chronic disease and helping people manage them, we're also working on the other end to work with our legislators and our community leaders around having bike lanes and school gardens and, you know, kind of catching it downstream, as it were.
And really living in cities, having a city be walkable is huge, you know. And I'm not sure why New London isn't more walkable or bikeable than it is. Its small footprint would seem to really make it a prime candidate for being very walkable. But I know that if I take the train and go to New York City for a day, I'll walk 10 times more in that day than I will in New London.
Yeah, isn't that incredible?
And I haven't figured that out yet. Yeah. That's another piece.
I got to say, I was just talking to Mayor Passero today and saying that there's some magic to it when we have our farmers market at Williams Park. And maybe it's part of where Williams Park is. But there, I think, what is it? It's like 6 different ways to get there. And it's so incredible when you see all the vendors are all set up, the tents are up, the fruit is out, and you start seeing people walking to the market from all four corners. And I think that there are more people walking now than ever before.
I think there are. And I've recently been talking to, young people who are moving, and also retirees, who are moving closer to the center of New London so that they can walk downtown.
And a lot of people have eliminated their cars. They're not even buying cars anymore. So
I really like where I live, but sometimes I wish, if I were like not 2 miles from downtown, but 3/4 of a mile from downtown, I'd be walking a lot more.
Yeah. Well, you can always get your bike and bike halfway, right?
Biking from where I am all the way to the end of Montauk Avenue is really is really pretty painless. And I was a bicycle commuter for many years when I lived in Pleasure Beach and worked at the hospital. But then crossing Bank Street, we have to figure out how to cross Bank Street so that it feels safe for pedestrians and for bicyclists. And
I think they're working on it. There's always been discussion about certain intersections and how dangerous they are.
Yeah, and that's the one part of it that just seems kind of frustrating to me. It's like, how do you cross Bank Street and it's 5 lanes in places and feel safe? And it isn't even that good for the drivers. Like, people in cars are always complaining about the congestion and the confusion. So from a planning our environment point of view, that's it's something that's kind of fascinating to me.
And the way that some communities have kind of tackled a little bit of that is by staggering work hours and having people have flex hours so that schools and businesses aren't all getting out at the same time and starting at the same time.
And I think that would be really useful. And I think we do still have some streets that could be turned into complete streets. And
I agree.
would be friendlier to walk on. If I try to walk, I live near the hospital, so if I try to walk downtown, it isn't that it's that difficult, but there's no shade and there's not much to see. It's not too scenic. And so it just doesn't feel welcoming. It isn't just that it's 1.5 miles, because a mile and a half can seem like nothing sometimes.
And if you look at some of the big cities like Minneapolis, Minnesota, Atlanta, Georgia, parts of San Francisco now have really made their walkable areas or their walking areas attractive. They may have benches so that if people do get kind of winded or need to rest, they can actually sit down. Just making sure that there's something that's pleasant. The sidewalks aren't broken, and that sidewalks and walking areas are safe and pleasing to the eye.
And one thing that, when you were talking about the bicycle lanes, it's great the Montauk Avenue lane, but now the city is hopefully going to have some success in connecting Conn College and the Coast Guard Academy down William Street towards Hodges Square in downtown. And that would just be fantastic. It would pull the whole city together.
Yeah, I think that would be amazing.
Now, on a totally different subject, I could actually talk about bicycling for quite a long time. But one thing that the Ledge Light website also mentions is communicable diseases. I know that chronic diseases seem to be the big challenge of our times, but that doesn't mean that communicable diseases are not a problem, because they can be. So what does Ledge Light do to promote awareness?
Well, part of the function of a health department, public health department, is to control the spread of disease. So every year, the Connecticut Department of Public Health puts out a list of reportable diseases. These are usually diseases that are infectious or can be transmitted from one person to another, but not always. And public health departments are supposed to respond to those reports. So a physician would submit a report on a patient who, for example, has tuberculosis. And then it's our job to follow up and to make sure that that person with whatever disease they have is under the care of a physician, is taking the appropriate medication, is limiting their contact with other people if that's appropriate, and then also contacting people that the infected person may have come in contact with, to let them know possibly that they should get a test for whatever bacteria or virus they may have come in contact with. So we work very closely with nursing facilities, long-term care facilities, schools where there may be an outbreak of a norovirus or something else, and really work. Sometimes we work with the State Department of Public Health if there's an outbreak, but it really is our job to control the spread of infection.
Now, are there, are the schools particularly a vector for infection, or is it just?
Well, when you think about kind of what puts somebody maybe a little bit more at risk, having a lot of people in close proximity, in a closed environment. So, we do see more norovirus, for example, during the winter months because of that.
And that indoor air is not really that good for us.
Right. And so, but we see on the other hand, during the summer, we see more Lyme disease, babesiosis, or ehrlichiosis, which are vector-borne illnesses. We look for Triple E and other mosquito-borne illnesses in the summer. So there's never a shortage, but just our interaction with each other and with the environment can put us at risk. We do a lot of education about hand washing this time of year. To keep your hands clean. In fact, I ran into somebody today and they fist pumped me instead of shook my hand because they just wanted to make sure that they didn't give me their cold. So,
this winter has been, I think all of my immunization from all the years I worked in child care centers has worn off. Now that I'm retired, I don't get as much exposure. So
they say if you want to have a good immune system, work with young children.
And I did that for a long time, but it didn't last.
Did you find yourself you were healthier then?
You know what? The first year I worked with toddlers, I was sick a lot, like 1 week a month. And then after that, I think, for 20 years, I was really pretty healthy.
Yeah, that's incredible.
And now, then I retired, and now when I visit the grandkids, it's like, I come home with a cold.
But don't you say, it's okay, it's okay.
It is okay. Yeah. It's fine. But we only have about 3 or 4 minutes left, so maybe you can let people know how they can either be supportive, how they can get information, what kind of things they might want to get in touch with Ledgelight on.
Okay, so we have several coalitions, and really go to our website and take a peek, but there's a lot of ways that people can participate, either joining our Medical Reserve Corps, participating on one of our substance abuse prevention coalitions. We work with all the municipalities. We have an asthma action partnership. So we have a lot of different coalitions that people can join. Right now we're looking to hire an ambassador for our farmers market who is fluently bilingual in both English and Spanish. We recognize that not everybody is English speaking, and we really want to make the market a place that's friendly for those people that are Spanish only speaking. So we are hiring a part-time person. I just want to put a plug in for that.
Yes.
So if somebody is looking for a part-time job that's temporary from April until the end of October and speaks Spanish, we're always looking for volunteers in different capacities. We have an internship program. So if somebody's in college and they're getting their major in public health or something related, we always seem to have interns at our office, which is really wonderful. But really just, get familiar with our website, give us a call, let us know that you have a particular interest or skill that you'd like to contribute, and we'll have you come in.
Okay, so in the last minute, when are the farmers markets starting and where will they be this year?
Okay, so we actually combined the two farmers markets in New London. We'll only have one market in New London this year. It will be on Fridays from 3 to 6. Starts on July 7th, runs all the way until October 27th. So every Friday, 3 to 6. We'll have a family day in July and a senior day in August. Those were really popular last summer. And then we also have our new market in Groton City, and that's going to be on Tuesdays from 3 to 6, and that'll start on the 11th of July.
And that's at Washington Park.
Washington Park, yep, and that will run until October 31st, so Halloween will be our last market there. But great fun. We're looking for vendors right now. People can call me if they have a small business and they'd like to come out to the market.
Well, thank you, Cindy. Ledge Light has been busy. And anyone who is interested in the diabetes workshop, interested in an internship, go to the website. There's information there to direct you anywhere you want to go. Next week, our show will be state budget related. I think Jonathan Pelto will be coming back to talk about the state of the state, and so it'll be something totally different. But we'll see you then, and thank you, Cindy.
Yeah, thank you so much.
Tucheze muziki sana, piga makofi wewe.